We are in the frame of treating cancers, which is a very important health issue. And treating cancers with surgery, radiation therapy, chemotherapy, immunotherapy, all what we have at the moment still leave around 30–40% of the patients resistant to all these type of treatments. So one of the main limitations of the conventional radiotherapy is that we cannot cure all the patients we would like to cure, for sure. And there is a need to have more efficient and possibly better tolerated radiotherapy. That's where the flash radiotherapy may be very promising. The flash effect is a biological observation which can be done when you irradiate tissues with very high dose rate. And this type of radiotherapy, given in milliseconds, has a remarkable sparing of normal tissue, while the effect on tumors is maintained the same. So you create a very strong differential effect between the tumors and the normal tissue. In the preclinical studies, what we see is that on all the tumor models which have been tested, the flash irradiation and the conventional irradiation are giving the same outcome on tumors. But on normal tissues, we have a remarkable sparing on all the situation which has been tested in preclinical setting. This has been observed for different species, in fact, in zebrafish, in mice, in pig, in cats, and it's a reproducible effect.
Efficacy of flash irradiation seems to be validated amongst all the species that we've tested so far, and it is also very efficient in all the organs we've been tested so far. I have to say still that probably it's more efficient in late responding organs like the brain or the lung, but still has some interest in acute tissues like the hematopoietic system, for instance, or the gut.
So now the main question is, how can we translate this in patients, in clinical practice? And well, we have just treated one patient, and so far the flash irradiation was successful, but it was very specific cancer with patients with skin cancer, superficial disease, and we had a flash treatment there which was feasible and safe. Now we need to move ahead and treat more patients, and the most difficult challenge is to have the medical device that will allow us to do this clinical translation, which now we have to do. The first LINAC we've been using for treating a patient was a LINAC which is a prototype installed here at the CHUV for 5 years ago. And this LINAC is built by PMB, a company called PMB. This is able to treat only superficial disease, and the penetration in tissues is less than 2 centimeters. But it was a first attempt, and I think, as I said, a successful one. What we saw in the preclinical setting is that it works with high dose perfraction. That means that above 10 gray, if you give more than 10 gray, you see more obviously the flash effect. And then we can think about applications where we already use this type of high dose perfraction. And the most straightforward is probably intraoperative radiotherapy. Because here we give single dose of radiation, high single dose, and if we get a flash effect, a flash benefit on the normal tissues that we irradiate, then we could enlarge the scope of intraoperative radiotherapy. which is very important for the tumors, for instance, the one we cannot really cure with surgery, because there is a little bit of tumor left in the tumor bed. And then flash radiotherapy could help in this situation. That's what we are going to test very soon.